Welcome back, future lifesavers. In our last episode, we saw Zeke and Anya tackle a multi-vehicle collision. Today, we're diving deep into patient assessment and emergency procedures. Let's tune in and see what challenges our dynamic duo faces next.
This is Captain Dave, coming at you on First Responder Radio. We're about to get a masterclass in emergency care from our seasoned pros. Listen up, folks.
All right, Zeke, pop quiz time. What's the focus of the initial patient assessment?
Easy, ensuring the scene is safe and identifying life-threatening conditions using the ABCs, airway, breathing, circulation.
Good. And what about the secondary survey?
That's a more detailed examination to find any non-life-threatening issues, like being a medical detective.
Excellent. Now, let's say we arrive on scene and find an unresponsive patient. What's our first move?
Check for responsiveness, call for help, start chest compressions, give rescue breaths, and use an AED if available.
And what's the rate for those chest compressions?
120 compressions per minute. Staying alive, baby.
Good reference. Now, what if we encounter severe bleeding?
Apply direct pressure to the wound. If that doesn't work, elevate the limb and, if necessary, use a tourniquet.
Perfect. Let's talk airway management. What's the head tilt, chin lift method used for?
Opening the airway in unconscious patients, but if we suspect a spinal injury, we'd use the jaw thrust maneuver instead.
Correct. What about OPAs and NPAs?
They're used to keep the airway open. OPAs for unconscious patients, NPAs for those with a gag reflex.
Good. Now, imagine we encounter a patient with a suspected fracture. How do we manage that?
Immobilize the area using splints and minimize movement. Treat it like fine china.
Nice analogy. What about shock? What are the signs?
Pale or clammy skin, rapid pulse, confusion. It's like their body's going into panic mode.
And the initial treatment?
Lay the patient flat, elevate their legs, and keep them warm. Basically, make them as comfortable as possible.
Excellent. Now, let's talk burns. How are they classified?
First, second, and third degree based on severity. The higher the degree, the deeper the burn.
And the immediate treatment?
Cool the burn with water and cover with a sterile cloth. No butter or home remedies.
Good reminder. Now let's revisit CPR and AEDs. What are the steps for using an AED?
Turn it on, attach the pads, analyze the heart rhythm, deliver a shock if advised, and resume CPR. It's like giving the heart a reboot.
And why is early CPR and AED use so important?
It significantly increases survival rates in cardiac arrest situations. Every minute counts.
Wow, folks. Zeke and Anya are really covering all the bases. But wait, it looks like they're getting a call. Let's listen in.
Ambulance 26, respond to 456 Oak Street. 55-year-old male, possible heart attack. Patient is conscious but in severe pain.
You heard it, Zeke. Let's roll. What's our game plan?
First, we ensure scene safety. Then we'll do our initial assessment focusing on the ABCs. We'll need to be prepared for potential cardiac arrest, so let's make sure we have our AED ready.
Good thinking. What else should we consider?
We'll focus on our primary assessment and be prepared to start CPR if needed. We should also have our oxygen ready and monitor the patient's vital signs closely.
Excellent. Now, as we arrive on scene, what's our first step?
Ensure scene safety, then approach the patient. We'll introduce ourselves and start our initial assessment.
Good. What are we looking for in our primary assessment?
We're checking the ABCs, airway, breathing, circulation. We want to make sure the patient's airway is open, they're breathing adequately, and have a pulse.
Perfect. And if the patient becomes unresponsive?
We immediately start CPR. Chest compressions at a rate of 120 per minute, at least 2 inches deep, allowing full chest recoil between compressions.
Correct. And what's the importance of that full chest recoil?
It ensures the heart fills with blood between compressions, making our CPR more effective.
Excellent. Now, let's say our patient remains conscious, but is showing signs of shock. What would those be?
We'd look for pale or clammy skin, a rapid pulse, and confusion.
And how would we manage that?
We'd lay the patient flat, elevate their legs if possible, and keep them warm. We'd also provide oxygen therapy as per our protocols.
Good. Now, throughout all of this, what's something we should always keep in mind?
The importance of empathy. We need to provide emotional support and reassurance to the patient and their family. This is a scary situation for them.
Absolutely. How else can we ensure patient safety?
We need to secure the patient properly for transport and continuously monitor their condition. We're their lifeline until we get to the hospital.
Perfect, Zeke. You're really putting it all together. Remember, we're working within our scope of practice as EMTs, so our focus is on assessment, basic life support, and rapid transport.
And there you have it, folks. Zeke and Anya turning a potential heart attack call into a masterclass on EMT-level emergency care. Remember, knowing your role and scope of practice is just as important as knowing the procedures themselves.
Absolutely, Dave. It's crucial for EMTs to understand their scope of practice and work within it. They're a vital part of the emergency care chain, focusing on rapid assessment, basic life support, and getting the patient to definitive care quickly and safely.
Great point, Don. And it's clear that even within their scope, EMTs like Zeke and Anya can make a huge difference in patient outcomes.
Indeed they can. And to our listeners, remember, your scope of practice may limit what interventions you can perform, but it doesn't limit the care and compassion you can provide. Always strive to give the best care possible within your training and protocols. Now, here's your homework. Review your local EMS protocols, particularly focusing on cardiac emergencies. Practice your assessment skills and CPR technique. And most importantly, reflect on how you can provide empathetic care in high-stress situations.
Great advice. And don't forget to stay up to date with your certifications and continuing education.
Thanks, Dave. And thank you, future lifesavers, for tuning in. Next time, we'll dive deeper into trauma assessment and management. Until then, keep studying, stay prepared, and remember, in EMS, knowledge, skill, and compassion save lives.